In this month's Overcoming Pain segment, Dr. John Birgiolas of Spine Pain Diagnostics Associates spoke with us inside the Ambulatory Surgery Center in Niagara, Wisconsin, about a new pain mitigation technique. It's called Spinal Cord Stimulation.
So spinal cord stimulation is one of the more advanced techniques that we have as pain physicians, and it's usually utilized for more debilitating diseases, which can be in the lower extremities, upper extremities, in the chest wall, and even the low back. And so we actually implant tiny leads into the patient's epidural space, and these leads are connected to this battery generator. So these leads that are implanted into the patient's epidural space actually generate a current, which helps dilute the pain signals coming to the patient's spinal cord. A simple analogy would be if you were to hit your hand with a hammer, the first thing that you do is you kind of rub that hand. That helps dilute the pain because you're stimulating surrounding areas that haven't been traumatized, and that helps dilute the pain signals and override those pain signals coming to the spinal cord. And so that's how the spinal cord stimulation works. So there are certainly a number of candidates for spinal cord stimulation. The number one candidate in the United States is actually after a failed back surgery. So you have many patients who have had either one or numerous back surgeries, and yet they still have that low back pain or lower leg pain, and yet are not surgical candidates anymore. So there's certainly one candidate, and then other candidates may include patients who suffer from chronic regional pain syndrome or other diseases such as peripheral vascular disease, which has resulted in ischemia and therefore severe pain in the lower extremities. So what's beautiful about the spinal cord stimulation is that you actually get to go through a trial period. So it's like a test drive. So you actually have the patient on the table, you actually place the leads in the patient's epidural space, and these leads are connected to that battery generator, which I showed before, and this is simply taped to the patient's back. They actually get to go home with it for a week or so and kind of test it out. So they get to see if this is going to be a device that's going to work for them. They come back a week later, we take the leads out, which is very simple. It's done in a clinic room, and then the patient kind of goes through with us if they want to proceed with the implant or not. If an implant is decided on, then you go through the same procedure again. The leads are placed, and this time the battery generator is actually surgically implanted in a simple pocket underneath the skin, which is nice because it actually sits underneath the belt line and no one would even notice that you had this device in place. Spinal cord stimulation is covered by most insurance companies, and regardless, we try to work with them as best as we can in order to get it covered.
And you can learn more about this technique. Again, it's called Spinal Cord Stimulation at paindiagnostics.net. Overcoming Pain is a segment that airs here on Local 3 News the last Thursday of each month at 11 o'clock. To submit a question for Dr. Birgiolas, you can go to our website, upmatters.com, click on the Spine Pain Diagnostic Associates graphic. In our Money Watch report tonight, the focus is on payday lenders and on one state that has the fastest growing metro areas. Lauren Lister has those stories, plus a look at the closing bell.